This time of year can be a bright spot, but it can also be a reminder to some of loved ones who have been lost to suicide. Doug Vance with the Brazos Valley Coalition on Suicide is here to talk more about this. Thank you so much for being here.
Thank you, and Merry Christmas.
Merry Christmas. We wanted to talk about ways to support our loved ones during this time, whether that's friends or family. We know that the holiday season can be a difficult time. So can you tell us more about what you see in your line of work this time of year?
Well, there's a lot of holiday depression that goes on. Suicide actually goes down in the winter months. It's extremely high in summer and spring, but we know that New Year's Day is one of the highest days typically for suicide attempts and suicide completions. So people struggling during the holidays with all kinds of added stress, activities, trying to make the perfect event go down at their house. So we see a lot of that. Plus it's a big time for, like, if you've lost somebody to suicide or any other reason, and it's the first holiday in particular that they're not there that first Christmas, it can be very difficult. So we see a lot of that also.
Whether someone is struggling personally, has lost a loved one, or wants to support someone that they may know, how can they go about doing that? What are different ways that people can show support?
Well, number one, you need to recognize what's going on with somebody. There's recognizable warning signs and predictive risk factors. There's things people say. If I'm talking about, my life is no good, I wish I wasn't around anymore, I wish I was dead, that's a red flag. If I'm looking online on ways to kill myself, if I'm putting my affairs in order, if I'm gaining access to lethal weapons or something like that, or lethal means, that's a red flag. If I'm showing signs of depression or hopelessness, which is really significantly correlated with suicide, those are things people need to pay attention to. And if you notice that in yourself or loved ones, you need to reach out and ask them. We advise people to ask them, hey, are you suicidal? Have you thought about killing yourself? That's different than have you thought about hurting yourself? And you won't put it in their mind. They're not going to give them the idea to do it, but you're going to build a rapport with that person where they're going to feel comfortable to tell you the truth. If they say, yes, I have been thinking about it, then the very next question you have to ask is, how would you do it? You have to assess lethality. If they have a well thought out plan, you don't leave them alone. You get them to help, you call a physician, you take them to the ER, you take them to a psychologist, a counselor, somebody to get them immediate mental health help. So that's what we advise.
So when approaching these conversations, it's best to be direct?
Very direct, and you want to have empathy and concern, and you want to listen more than you talk, but you want to be direct. You don't want to beat around the bush. If you feel somebody may be feeling hopeless, or to that point they might be thinking about taking their own lives, ask them the question. Get it out in the open. If not, then fine. Okay, I'm here. What's going on? Let's talk. But if it's, yeah, I've been thinking about it, well, tell me more about that. Do you have a plan? Have you thought it through? Have you attempted before? What's going on? Start that conversation.
And there are resources right here in our community. Can you tell us more about that?
Sure. United Way 211 is always a great resource that has a list of almost any social service agency people need. The Brazos Valley Coalition of Suicide Prevention, we do crisis intervention, we do support services, we do education services. We'll come to your business, your church, whatever, and put on a presentation. We help the people develop suicide prevention plans. Also, 988 is a really good number. It's a 3-digit number that came effective in America in, I think, June of 2022. It's been over 11 million calls since then, I believe, last number I saw. And you can talk to a trained mental health specialist if you're feeling suicidal, or somebody you know is. You don't know what to do about it, how to handle it. They can connect you with a resource in that community or that zip code you're calling from. Also, they can talk to you or the person and help de-escalate the situation if you don't know where to go to. There's always emergency rooms, and hospitals can help also.
We'll be sure to put information about resources on our website as well. But Doug, thank you so much for coming in and talking about this and giving us some resources to share. Sure.
I'd like to mention one thing, if I could. Anybody who's struggling out there with any mental health issue, doesn't have to be suicide. We at the Brazos Valley Coalition on Suicide Prevention offer a peer support group the first Tuesday of every month at 6:30 p.m. at Fellowship Free Will Baptist Church in BRYAN. Just reach out to the Brazos Valley Coalition on Suicide Prevention. I'm sure you'll have our information up there. Reach out to us. We'd love to get you connected to that. It's free of charge for any adult with any life issue that they want to talk about or be part of a support group. We'd love to have you join us.
Yes, sir. Thank you so much for your time.
Yes, ma'am. Thank you.
I appreciate it. We'll be right back after this.